Hi everyone, welcome to my channel Haemodialysis Simplified. In these small sessions, we will be discussing on various aspects of hemodialysis. In this particular session, session 3, we are going to discuss about how to take care of an AV fistula by patient as well as caregiver. So the learning objective today are how in general what care need to be taken care. First time when we cannulate, what measures to be taken and what is a post dialysis AVF care for the patient perspective. And again, we are discussing about the warning signs to look for in case if there is an issue with the AV fistula. Investigations, if required, to analyze the fistula on the longevity or any kind of issue. In case there is a clotting issue, how to declot if required. And most importantly, in case there is an emergency, bleeding, unexpected bleeding, how we can handle this bleeding. So these are all only the guidelines, whereas I suggest you to go with your sender protocol for better understanding and don't change anything unless your sender in charge or the physician concerned suggests you to change. So this is one basic thing we need to look into. By the patient need to clean their fistula hand every day as how they take bath every day or whatever. So this need to be done with soap and water, just a casual washing, and never use scrubber, because when you use a scrubber, it can create small crevices or rough surface over the fistula or even can damage the fistula. So never use a scrubber. This is a simple washing with soap and water will do. Another thing is when a fistula is developing or after developing, never check the blood pressure on AVF hand, because it creates a little bit of obstruction and that can damage a fistula. So again here if you see if a blood pressure cuff is tied and it is inflated, this can create tremendous amount of pressure on the AVF hand that can sometimes damage the fistula. Again, we need to advise a patient not to wear very tight clothes on the fistula hand, especially full sleeves with tight buttoning. So this again can obstruct the fistula. And another thing we need to take care is do not carry heavy stuff on the fistula hand, because we are exerting a lot of pressure on the anastomosis site and we are giving a little strain to the fistula hand. Again, a couple of things we need to keep in mind is that uh, when in any emergency situation, if they are not coming to the dialysis unit or going to a nearby hospital, uh, people in the hospital may not be knowing that this patient is undergoing hemodialysis. So in case they need to put a cannula, they should not put any cannula on the AV fistula hand, or they should not insert any infusion line on the AV fistula hand, because this might damage the fistula. And again, in the third party, when they collect blood, never collect the blood from AV fistula, because the person who handle may not be knowing what it is and how it is done. So the patient and patient relatives should be aware of this, and in case there is an emergency situation, they go anywhere other than a dialysis center. Another issue is pruritus or itching is very common in hemodialysis patient, and sometimes they use some instrument or nails vigorously on the fistula hand for scratching. This again can create bruises over the hand, and it can cause infection. So never encourage to scratch the hand, fistula hand vigorously in case of an itching. Patient again need to check their fistula in everyday basis, whether there is a bruise or thrill on the anastomosis site. If there is no thrill or bursting, so they need to report immediately to the dialysis unit because the fistula might have damage due to some reason. So every day they can check it just by pressing their finger on the anastomosis site. They can understand whether the brute or thrill is there over the hand. So this also patient can do it at home. Again, when before we cannulate the first time, we need to give a thorough counseling to the patient, why we are doing this, why fistula is better than any other temporary axis, what is the advantage, and what need to be taken care in case they are sleeping, they should not sleep over the hand, or they should not lift heavy stuff, or any sharp object they are handling, it should not puncture the hand. All these aspects should be explained to the patient, and also patient need to be educated on post needle removal protocols, post needle removal procedure, what they need to take, when they need to loosen their plaster, when they need to remove the plaster or tunicate. So that also need to be explained to the patient. So a thorough counseling before the first cannulation would reduce a lot of apprehension in the patient's mind, and that create a very good platform for needling in the first time. This is again quite important because patient must be driving or they must be going on the street with street cloth. Maybe there are a lot of dust accumulated over the fistula site. Of course, we will be cleaning before needling, but it's always better to encourage the patient to wash the hand, fistula hand, especially in the cannulation area before we proceed for cannulation. So always encourage them to wash with soap and water, not to use any kind of brush or nail for cleaning the area, and no scrubber to be used. It's a simple soap and water wash would do. That will tremendously reduce the amount of infection in the fistula site. So again, for the dialysis staff, it's always important to understand that AV fistula cannulation is a clean hand procedure. That means the person who cannulate the fistula should have clean hand, and patient also should have clean hand. So when both the hands are clean, the infection chances are very less. So this is very, very important because we need to follow the clean hand procedure. Both patient as well as the caregiver's hand should be clean before the procedure. Some patient, they are very, very tall, very, very intolerant to the so-called pain. So if require, we can give a little bit of local anesthesia apply a little bit of local anesthesia over the proposed cannulation site or needle puncture site, either by injecting local anesthesia with a small needle or by applying a gel, anesthetic gels over the cannulation site, which would help both in psychologically as well as physically if there is a pain. This will definitely reduce the pain over the puncture site. Again, post-dialysis care, as we explained earlier, we need to explain to the patient very well how they have to take care of the hand, not to do exercise on the day of dialysis, post-dialysis, because this will activate bleeding through the puncture site again, when to remove the plaster, when to loosen the plaster, how to take care of the hand. All these need to be explained to the patient, as I mentioned earlier. So when we needle, one thing we need to make sure that it is better always we follow rope ladder technique. As you have seen here, this is a 4 years old fistula, I would say. So if you see in 4 years before, this is the pattern of needle, one side every day, likewise Monday, Wednesday, Friday, Monday, Wednesday, Friday. So likewise, we will have various points for insertion. If you follow this, if you after a couple of years also, you don't see much of aneurysm over the cannulation site, and you will see a straight vessel without much aneurysm. So this is the best practice needling when we can do an AV fistula. Again, after removal of the needle, it's always suggested to put a semicircular adhesive plaster, not to put tourniquet as much as possible, because the tourniquet would obstruct the backflow of fistula. It's just like you are building a like a dam against a river. So there will be pooling of blood over this side, and that will be eventually on long term will form a lot of aneurysm. So it's always better we allow the puncture site to clot. After that, apply semicircular adhesive. So that's always advised. And if there is a bruising or swelling after needling, this need to be immediately brought to the notice of the medical officer, because this must be because of a little bit extravagation due to counterpuncture of needle, and probably because of excess anticoagulation. So this might cause a little infection over this area. So it's better when there is a bruising and swelling, this need to be brought to the notice of the medical officer immediately. And another thing is aneurysm. This probably would be a massive picture, but when you feel that the vessels are becoming bigger and bigger or balloon size, that's the beginning of starting an aneurysm. So it's always better we need to inform the medical officer, because if you allow this to happen on long term, the peripheral area of this vessel will get narrowed as shown here, and that result in clotting of this entire segment, and this fistula will go forever. So another warning sign is redness or heat. This could be because of some kind of infection. If there is an infection over here, that need to be taken care in the appropriate time. So if there is a redness or heat, this need to be brought to the notice of the medical officer. So it can be immediately taken care by giving the medication or local application. Again, if you see, this is another nagging problem in most of the end-to-end anastomosis patient. If you see here, patient will get numbness or feeling very cold during dialysis, especially because what is supposed to be supplied to this part of the hand is diverted over here. If you see this diagram clearly, the arterial flow is diverted through a vein. From here, the 100% flow, if you cross this area, it will be about 25%, and 75% will be flowing back to the vein. So the remaining part of the hand will have lesser blood flow. Because of that, especially during dialysis, patients feel numbness or they feel very cold over the hand. But nothing much can be done in this case except using a kind of a warm water bag, or covering the hand with a woolen cloth or whatever. So they feel a little bit warmer, and they feel a little comfortable, because this is basically due to the construction of this particular type of anastomosis. Again, allergies. In case patient have some allergy, it could be anything. It could be even the anticoagulant or anything. Any allergy, you will see this kind of coloration around the AV fistula. That again need to be brought to the notice of the medical officer, so that it can be taken care immediately, because this allergy will actually create itching, and patient start scratching this, and maybe some wound formation, and it get infected on long term, and this can damage the fistula. Over here, this is again another important slide. If there is a wound or angry looking wound or infection kind of thing, or a shiny skin with, if you feel with your finger, you will see pulsating feeling over this particular area. So if this is really a alarming situation, so this should be immediately brought to the notice of the medical officer so that corrective measure can be taken surgically or by some medication or some application. So this need to be taken care immediately, because this is not a great sign for a fistula patient. So if required, suppose a fistula flow is not adequate, if you feel, if require a fistulogram need to be done, they will do a series of test over the vessel segment and to analyze the flow. If required, this need to be done in case there is any lesser flow, or if feel that the flow is not adequate, so this is recommended. So a fistulogram is recommended in case the flow through the fistula is, you feel it is not adequate. And in case there is a clotting inside the vessel, this is very unlikely, but if it happen, it may not produce much result also, because clot formation might have happened several hours or days ago, and removal of this may not be very successful, but still can make a trial by inserting a guide wire kind of thing with a suction end and aspirating the clot. Sometime we can revive this fistula. And the very unlikely scenario, or if there is a massive bleeding, suppose the patient finish dialysis and go home, and or in case after removal of the needle, immediately you will see massive bleeding over the needle insertion side. Actually, we need to apply the pressure till it clots with adequate pressure. So only thing, it is dangerous if the patient leaves the center and they are in public transport system or they are driving. If there is a bleeding, then immediately they need to stop the bleeding by pressing. This need to be educated to the patient. If they are nearby the dialysis center, then they have to rush to the dialysis unit. Then not to get panic, to press their hand with available bandages or cloth, then just press over the site without losing much of blood, and rush to a dialysis unit. And this is the worst case scenario if there is a massive spurting bleeding, like a pipe broken and water is gushing out. There is another method called application of bottle cap, which is very unlikely, but this will be helpful in case of emergency. So that's all from me. Thank you very much for your time and patient listening. Thank you very much. Take care.